Cartilage will be part of the skeletal system, and so with this organ system, the tissues are going to grow and change throughout life and will also include the bones, ligaments, and other supportive tissues. So cartilage, let's talk about functions here. Support for soft tissue. So let's give an example, like within the airways, within the respiratory system, so it helps to hold our trachea in place. Also, for example, the auricle, the outermost portion of our ear. Another example is going to be the gliding surfaces at articulations, or these are known as our joints. So these are going to be at smooth surfaces where bones are going to meet. And also cartilage is going to be the precursor for bone growth. And we see this especially when with fetuses and newborns, they have more cartilage than bone. And so over time, it starts to calcify and becomes bone. Cartilage is going to be semi-rigid connective tissue and it's going to be weaker than bone. However, it's going to be more flexible. And so mature cartilage, which are going to be our chondrocytes, these are going to be avascular. So again, lacking blood vessels. So let's talk about the two different types of cells. First one's chondroblasts. So these are going to produce the extracellular matrix for our chondrocytes. So our chondroblasts means that these are immature cells versus chondrocytes. These are going to be our mature cartilage cells, and these are going to be surrounded by a matrix and have these small spaces that are called the lacuna. And in our example here, the lacuna is this entire space, and within the lacuna, that's where we find the chondrocyte. So in this example, we find two chondrocytes that are within that one lacuna. We have three different types of cartilage found within the body. The first one is hyaline cartilage. This is going to be the most abundant within the body. However, it's going to be intermediate in terms of strength for the body compared to all three cartilage. All right, so this is our intermediate layer. Now, when we look at it, it has this glassy-like appearance to it because of the extracellular matrix. And that's due to the protein filaments that are found within it. So collagen is going to be the abundant protein fiber that we find, but there's also other proteins that help to give it this translucent appearance. And so some examples where we find hyaline cartilage includes the cartilage found within our nose, the articular cartilage of a joint, so bone on bone. Also costal cartilage, which attaches the ribs to the sternum. And another example here, cartilage of joints, so like within our ankles, within our hands, within our elbow would all be examples, as well as the cartilage that helps hold up the larynx and the trachea for our respiratory system. Now, the second type of cartilage that we have is going to be fibrocartilage. And this is the strongest of the three types of cartilage. For this one, the extracellular matrix is less than that of hyaline cartilage, and the predominant fibers that we find are many different types of collagen, so that's going to give it its tensile strength. All right, so we find this in a few places. We find this as the cartilage between the intervertebral discs, as well as with the pubic symphysis, which holds our hip in place. And when women who undergo childbirth, though, there's a hormone that helps to relax the strength of this so that the fetus can be delivered. And then the last place that we find this is within the meniscus, within the knee and the femur. And the last type that we have is elastic cartilage. And elastic cartilage is only present in a few places. So the external portion of the ear is one example. Also within the epiglottis, so what will move up or down when we swallow, as well as within the inner ear. So as you can imagine, the protein fiber most predominant is going to be elastic, and so this is going to give it its huge amount of flexibility.